So within the next 10 seconds, we will be live.
Okay.
So on a three, two, one, we are live.
Okay, thank you. Good evening and welcome. Myself, Dr. Shavik Chaudhary, Medical Service Manager, Lupin Limited. I think all of you are aware that International Men's Day is on 19th of November 2021. And for that, we are celebrating this International Men's Week. And for this, we have organized a patient-centric series of web talk. So today is the third day, and today we'll discuss on sexual link health with men's health. So before starting the discussion, let us welcome our eminent speaker. Today, our eminent speaker is Dr. Sanjay Pandey. Dr. Sanjay is working as head andrology and reconstructive urology at Kokilaben Dhirubhai Ambani Hospital in Mumbai. I welcome you, sir, in this expert web talk, and I am sharing the dice with you with a fruitful discussion. So my first question today from the audience is, what kind of changes men can expect as the age advances or after andropause?
Dr. Shobik, good evening. Welcome to day three of a very vastly planned, attempted movement on International Men's Health Day, which we are converting to attempt to reach our colleagues over a week. The question about what changes do we look at as men age gracefully at and beyond andropause is all about organ changes, is all about mental and physical changes. Let's look into that in a very short detail. In one way, you are at the prime of your life. That means you are so-called andropause, which is a late onset hypogonadism, or the age group when your hormones are undergoing a change. Hormones undergoing a change, you can look at your counterparts, women who undergo menopause. So the body, which has actually been peaking together in all aspects, gradually goes down. In men's health, andropause or late onset hypogonadism or a male menopause is related to the hormone called testosterone. As a result of the testosterone going down, there are umpteen changes happen around, which happens both in the mind and body. Let's look at one. Men would look at their early morning erections gradually going down. They may not find erections as capable enough in the bed. They would look at their organ getting shorter and shrunk. The testicular function also goes down where the testis also feels shrunken. They look less confident overall because the hormone levels have gone down. So, both in mind and body, the testosterone happens to be a kind of a magic potion. It being there on the first 45 to 50 years of your life, you feel very confident overall. Your muscle mass may gradually go down in andropause. That means as age changes from 40s to 50s and beyond, while you were at your plateau and peak and then you gradually going down, 50 plus, the muscle mass may weaken up. There's a possibility that you feel a little grumpy and more drowsy and more sleepy. Your entire energy wise, you feel less. For example, if somebody comes in late 50s, 60s and say, I feel low on the energy, both mental and physical, and you know that he is of that age group where other history suggests that he has a poor early morning erection, which is a marker of andropause or male menopause. He is sexually on the lesser side. He probably is very grumpy. He's not capable. And you look at that, there are multiple changes happening in around. So to cut it short and give you an idea that men who age gracefully in their 50s, 60s will have hormone going down. The term that you labeled andropause, a very loose term, which medically we call as a late onset hypogonadism. The hormone going away brings about changes on every aspect, which includes the brain, the muscles, the bones. You can develop easy fractures. You can have your muscle mass weak. You will feel low on your energy. You will feel low on your sexual drive. The capability to perform also gradually could go down. So, one hormone, which is the bandmaster of the entire orchestra of a male, gradually going down, brings about a lot of changes around. And those changes are sometimes very gradual and not surmise around. And therefore, when men come in that age group, which is 50s and beyond, and we look at their morale, their capability, their physique, and their entire sexuality going down, then we know look at the general health and the sexual health going down. We look at all those organ changes and capabilities going down. So this is common when the hormone goes away. And therefore, if somebody complains of that kind of stuff, as a urologist, as an andrologist, we focus ourselves into identifying and treating.
Thank you, sir. Thank you for this excellent explanation. So we are just going to the next question, sir. Can a husband and wife transmit urinary tract infection to each other, or can sexually transmitted disease be acquired from the toilet seat?
So we're looking at health, and if we're looking at safeguarding our health while in sexuality, nothing should go wrong. That's what today's larger topic is. That means, as an individual, as a male, and as a couple, nothing should go wrong. So, two important questions that you have put in, Dr. Shovik, which is an audience question. The first one is, can urinary tract infection be transmitted? So that's not true. The
Yeah.
transmission of urinary tract infection doesn't happen. If I have a UTI, I will not transmit it to a partner. In other words, it's not about urine being transmitted. What gets transmitted across are the secretions and discharges and the kind of aspects where the uh, the the semen gets discharged into the vagina is one, and the vaginal fluid can get bathing the male organ and can possibly transmit those kind of bacteria which are not a part of the normal flora. For example, the vaginal bacteria is not a part of the normal male flora, and therefore there's a high possibility that that aspect can be transmitted to a male. So, what can be transmitted is sexually transmitted infections. But remember, post a sexual activity, a woman can develop a urinary tract infection because the urinary passage of men and women are different. Remember, the entire sexual and urinary passage made is completely different. Just to give you a quick explanation, the urinary and sexual passage of men goes through the penis and the rectum is far away. But in women, the urinary passage in terms of the urinary bladder and the urethra is one. Behind that is the vagina, and behind that is the rectum. So, post vaginal activity in terms of sexual activity, a woman needs to maintain a great hygiene, needs to clean up the whole area very well, lest she may land up with a urinary tract infection in a friendly neighborhood, which is the urinary passage. Bacteria are there in the vagina and in the rectum in a woman, and these bacteria do come into the introitus and probably soil the introitus. The demand for hygiene, therefore, is more in women than in men because the opening of the urinary passage is always contaminated by the vaginal and the rectal bacteria. So, there's a possibility the woman can infect herself rather than looking at a toilet seat. That means a urinary tract infection can happen to a woman not just because the toilet seat is dirty or the toilet is dirty. No bacteria is waiting in a toilet to jump into a woman's urinary passage or the vagina just because she sat into a toilet. The toilet seat may be dirty and all that, but the bacteria are already sitting very close to the urinary passage because the vaginal bacteria and the rectal bacteria, which are foreign to the urinary passage, where there's no bacteria, can easily cause infection. So, the transmission of urinary infection can happen in a woman from her own genital area, which is actually contaminated. And therefore, all women in the world need to maintain a great hygiene, a hygiene which
Right.
is demanded of your body because God probably made the organs little different in women compared to men. That's the bottom line, number one. And therefore, there are religions where, because they have to do prayers 5 times a day, they maintain a hygiene to much higher level compared to the hygiene that could be maintained by other religions. So, religion has a great science. Let's look into that. Number two, sexually transmitted infection is all about the transmission of bacteria or transmission of organisms, which are virus and fungi and microorganisms, which can happen during a sexual transmitted course of activity. And therefore, barrier contraceptives work very well. Irrespective of that, the male can be preserved. The woman needs to maintain a great hygiene post sexual activity by washing the introitus and the lower area, by passing urine and emptying her bladder before she goes to sleep that night. These are very important aspects. So, sexually transmitted infection is about transmission of the bacteria, fungus, etc. Infection is not transmitted as a result of sexual activity.
So, thank you, sir. Thank you for explaining in a simple, basic way. So we are moving to the next question. Why is the control of diabetes so important in erectile function? And your message to all the diabetics.
That's important. Now, when we look at all these important dates, remember you have got a diabetes day every day, World Diabetes Day, which was last Sunday, and we need to look into how to prevent a issue of diabetes on various organ systems. Now, diabetes is a metabolic disease, a disease which affects multiple organ systems. What you pick up is the blood level and identify yourself as a diabetic, looking at controlling the sugar levels, which is actually the barometer of your entire control and health. But as a diabetic individual, youngsters who are very young and diabetics who are uncontrolled and very young diabetics, insulin dependent diabetic mellitus, they actually develop two kinds of issues in the penile organ. One is called a diabetic microangiopathy, one is called a diabetic neuropathy. That means the nerves get affected and the vessels get affected. We were talking recently on day one of this important program that the erectile function stands on the tripod of good vascularity, good nerve issues, and good hormones issues. So, if your nerve issues are going wrong directly in the male organ, If your blood supply issues have gone wrong directly in the male organ, you possibly will not have an erectile function which is commensurate with your age or commensurate with the capability that you would have compared to the counterparts at that age group who have no diabetes. So, all diabetic individuals run a risk of, if being uncontrolled or long standing, running a possibility of sexual dysfunction in terms of losing an erectile capability good enough for them to maintain. Not only that, my message to diabetics is, if you don't control diabetes and diabetes is long standing, then possibly apart from what you develop here, you also develop a diabetic retinopathy, you develop a diabetic nephropathy, a kidney disease, develop a diabetic cystopathy where your bladder weakens up and the sensations go down and the urinary emptying becomes low. So, message to all diabetics is, diabetes is not a one-day disease. Sadly, it's a metabolic disease affecting multiple organ systems. To control diabetes, to bring about that lifestyle change in a lifestyle disease, is an important aspect all the time. And all diabetologists, all hormone therapists look into this, that your diabetes stays under very strict control, which means obviously on one side diet, the other side the lifestyle, the exercises, yoga, and all that you can do for yourself. And all people who watch this today in their 40s, 50s, and 60s, and if anybody is a diabetic in the, as an audience or a diabetic in your family, the control of diabetes is paramount. It is important that we look into that. Not having done that, we may land up in a catastrophe in due course of time. So for men, the sexual dysfunction is massive in terms of developing erectile dysfunction, which is almost not reversible. Most of our diabetics do not respond to medical therapy, which we give to other individuals, where they would require therapy by a penile processes because erectile mechanism is completely disturbed as a result of diabetic microangiopathy or diabetic neuropathy.
Right, sir. Thank you for explaining in simple way. So we're moving to the next question. What does a normal semen look like, and when should a person worry?
A good question, Shavika. This is more for our
Thank
general
you.
population to look at. A normal semen production is anything between 1.5 to 2.5 ml that you can ejaculate in one go. Some people could ejaculate even 5 ml, some could ejaculate only less than 1 ml. So when you have two less than ejaculate, you should get worried, because is there an obstruction to the ejaculatory mechanism? The ejaculate is actually produced by various fluid mechanisms in the pathway towards ejaculation, starting from the testis. It produces the spermatozoa, which is then stored by transmitting through the vas deferens into the seminal vesicles, which are various kinds of small bags just behind your prostate. They store them, and when you have this ejaculatory mechanism, the emission happens passively into the tract of the urinary passage through the ejaculatory ducts, and that's from where you actively ejaculate through the urethra to the female organ to the exterior, depending on the kind of sexual activity you are involved in. So, this entire aspect of semen being a fluid which normally gets liquefied by semenoglin, by a kind of a protein which is produced from the prostate, which actually would liquefy the whole semen and the semen would become more watery, is something where a lot of people get worried about. If you have a very watery semen, if you have a very thick semen, you get worried about. So remember, it is all about a liquefaction process where semen liquefies in due course of time. You should not worry about semen as a physical evaluation. Physically, the semen is a little bit of fishy odor. It is only that amount which could anything between 1.5 to 5 ml. A lot of people produce a lesser amount and then will get anxious and worried about. Not to worry, please. A lot of people can have bleeding in semen, and that can be very spontaneous. So sometimes we see that that is called as hematospermia. If there's a bleeding in semen, you need to see your urologist or your andrologist who will look at the causes. The commonest cause normally is non-specific inflammation, and few ejaculates, multiple ejaculates could settle it out. The cause is identified. Rarely it could be a tuberculosis or a cancer in the seminal vesicles and the prostate. And therefore, if somebody has got bleeding in the semen, need to worry about, but not to panic. Go and see your urologist in your town and city, and he will handle this by evaluation, by medical therapy, and by watching it. He may do a semen culture, he may do an evaluation, he may do a transrectal ultrasound, etc., etc. So the sexual health is linked to a lot of our mind and body issues. A semen is a fluid or probably a transmitting agent which allows the spermatozoa to be transmitted around. If your volume is too less, you need to be looking at if it's not obstructed. If you're bleeding, you should be aware of it. Other than that, I would not suggest anybody should be worried about semen as a parameter, as a physical amount to look at and get anxious about. It is something which in your formative or in your fertile years is produced. You look at it and probably feel good because it is timed with your orgasm. And if you have an orgasm in which you can see ejaculate, you feel comfortable with. There can be variations of it, and the variations are treatable by your uroandrologist in your city completely.
Yeah, thank you, sir, for the wonderful explanation. So we're moving to the next question. Why sometimes the sexual drive is lower than normal?
So the sexual drive, which in medical parlance is called as libido, is again a function of a lot of factors. A factor about understanding, number one, though you have grown into that mature years where the male hormones have come in around, it brings about that sexuality and the feeling about it, the feeling towards the opposite gender, and therefore you're capable of performing. The drive is best in the situation where your hormone is best. And when is your hormone at the highest level as a male? It is early in the morning. So early in the morning, when we look at testosterone levels, that's when we measure our hormone levels. It is actually the best level at that point in time. So the highest level of hormones is at that point in time, and that is what you need to look into. Are you able to hear me, Dr. Soik?
Yes, yes, yes. I
Yes.
can hear.
So the sexual drive is related directly to the availability of the hormones. For example, somebody comes
Yes.
in his 20s, 30s and say my libido is low, and we
Hmm.
look at all the other aspects being fine. That means the partnership is fine. There's no stress. There's no work-related tension. There's no injury. There's no trauma. There's no nothing. Then why should
Right.
your sexual drive or libido be low? So is your
Hmm.
hormone low? And therefore, we look at the hormone called testosterone.
Hmm.
Let's not
Yes.
actually keep hitting our testosterone all the time because testosterone, a male hormone, undergoes a variation in life, also variation in very fertile years. But when somebody talks about low sexual drive, the first thing which looks at it is the man very stressed? Is the man into psychological issues? Is the man going through a trauma? Is the man going through a personality change? Is the man requiring a counseling and probably a confirmation? Is there something wrong in a partnership? All these are important in a sexual drive at a psychological or at a larger aspect. On the hormone aspect, the hormone being low could bring about a low sexual drive. So it can happen to very young and even to very old people. Therefore, we need to look into the hormone as one aspect and the male capability going down. The sexual drive could be low. The drive could be low because your partnership is not fruitful. The drive could be low because your partner may not be supportive. The drive could be low because you are under stress to perform when you are not able to perform. So there are many more factors of low sexual drive. But overall, it is an internal feeling, and that feeling is a lot governed by hormones. Therefore, if I look at somebody is not able to perform well, and somebody has a low drive, I would directly look at that this possibly is looking at that this gentleman is having a hormone issue, is having an issue which is more related to the body and not the mind alone. So both
Yeah.
mind and body could bring about decrease in sexual drive.
Yes. Right. Thank you very much, sir, for explaining. So there is a next question. Is circumcision is recommended for everyone, or you recommend in some special cases?
So circumcision or treatment of phimosis, where the extra redundant skin of the penis needs to be removed, which
Yes.
is done religiously in all Jews and all Muslims, but is not practiced by other communities. So there is one way of doing a religious circumcision, where we remove that extra amount of skin, and it probably amounts to a good amount of hygiene and decreases the irritation to the tip of this sensitive organ called the penis. Number one. Number two, the aspect of looking at individuals who are having a tight skin. They wake up to their maturity in their adulthood in the late 15s, 20s, and 30s, where they find that the skin cannot be pliable or cannot move freely along the tip of the organ, which does not give them the sexual pleasure. If that is so, many people during their premarital and the marital years or just about to get married come and consult and look forward to a recovery on that aspect. And therefore, circumcision is warranted for people who have got a tight phimosis, a phimosis which does not let them perform a sexual activity, does not let them maintain a hygiene. For children who are born with a very tight skin, and the skin is causing a ballooning of prepuce, where a mother sees that the child, when passing urine, strains and the prepuce or the outer skin balloons around, we normally remove that. Children
Yeah.
who are getting recurrent urinary tract infection in their 3 to 7 years of life are getting a lot of infection, and the infection is fever, febrile, and they're all male children. We normally do a circumcision as one of the very common phenomena because bacteria are harbored out there which are transmitted internally. So, childhood circumcision is one. When they're becoming adults and adolescents and the skin is too tight and they cannot maintain a hygiene and cannot perform sexually, and they are getting to understand their body image, it's important to make them understand that the skin should be pliable. As you grow into maturity and adulthood, and the skin is not pliable and not mobile during your normal flaccid penis and during your erect penis, then the best way is to probably get a medical help, do a kind of a cosmetic circumcision, whereas as urologists and andrologists, we do at
Right.
the Kokelavian Hospital for patients. We clear the extra amount of skin and leave a lot of sensitive skin for them to perform. We also land up doing circumcision for patients who develop acute and chronic byelonoposthitis, where the skin gradually tightens up. And that's where I have a message for diabetics, where the skin can gradually tighten up and tighten up to such levels where you will have to remove it. That can happen at adulthood It can happen even in geriatric age group where the diabetes was not under control and the skin had to be removed because this was completely tight and choked and getting a recurrent urinary tract infection because of that.
Yeah, thank you, sir. Thank you for explaining this. I got a question. Maybe some of our doctor friend has asked. There is a patient scenario. A patient claims that both his testicles are not in the same level. One of the testicle is higher than the other. So the patient concern is whether he will face any problem after marriage because of this condition.
So we can
So
one
we can
single sentence, no. There'll be no problem.
thank you.
Our left and right hands are different. Our left and right foot are also
Right,
different.
right,
So both of them don't have the same size. Both of them don't have the same level, and not to worry. Scrotum is a bag where the two testes have come down. Be happy with it. God gave you something we should not be unhappy about. There are many people whose testes are inside the abdomen. You can find only one testis hanging around, and that's a sad
okay,
story. The other testis will be lying inside the abdomen because both the testes move from the abdomen and go down
right,
into the scrotum on the day of the birth. So, very important for us to have the two testes inside the scrotum fixed enough so they don't undergo a torsion or twist, which is
yeah,
important. To make you understand that this kind of an issue where we psychologically get worried, one testis is small, one is big, one is down, one is up, is only playing in the mind of a modern patient. Let's not look into that. Let's not make our audience feel that one test is low and one test is up. It's part of life. One will be low, one will be like normally one is low, right? One is normally on the lower side, the left, but one is smaller, one is bigger. Let's not go into that because that's more of an anatomical phenomena. An anatomy of two things may not be same. I don't think we should worry about it at all.
yeah,
We should be worried if both the scrotum does not have testes. If the scrotum bag, both the testes are not there and you're sitting on it, it's too late. We got to identify, do a sonography, MRI, and bring the testes sitting inside the abdomen down, which is very important for us.
yeah. Thank you, sir. Thank you for answering this scenario in a simple way. So we got another scenario from a doctor, an overweight and diabetic patient with normal serum count in his sperm analysis complains that he does not get erections easily and little semen is ejaculated during his play.
So
He wishes
if you
to,
understand,
yeah,
yeah,
uh, sir, anything? Should I repeat the
no,
question?
no, I've got it. So if I
Okay,
understand the question right, the question is about an
yeah,
obese individual
obese
where the
individual.
metabolic syndrome is such that
Ah,
he is in a situation where the penis may also be buried. He's a
absolutely.
diabetic and therefore his erection may be on the lower
Ah,
side.
yes, and little semen is ejaculated. So he wishes
So
to plan a baby. What to advise?
So got
Sir?
it, completely got it.
Ah,
I've got it.
yeah, thank you.
So one is he's obese, and obese
Ah,
people, if they're all fat in the pre-pubic area, many times the penis actually gets buried, which is another kind of a work that I need to look into.
hmm,
Buried penis cannot perform sexually, cannot handle the organ well. Sometimes they leak urine because the organ could not be handled as a result of a lot of fat in the pubic area. Now, they are diabetics also. If they are diabetics, then their sexual function itself is on the lower side. So once one way, the sexuality is poor. On the other way, you have got issues where you are very obese and cannot perform. So there are a lot of things happening in your life. If that is
right,
what it is, and you want to plan a baby, your erectile mechanism is poor, and you want to do a semen test, then the ejaculation may not be very easy around. Such people need to be looking at partner participation, doing many a times a semen test in the privacy of their homes and collecting it properly, because the proper collection is very important. So, a proper collection of semen can only happen when you're comfortable, not possibly in the busy hospital where somebody could knock, not possibly because you are one who's obese and who's diabetic and his erectile mechanism is poor, the entire mechanism in the pubic area is poor, and that kind of a scenario is not uncommon. So, taking care of your life, not increasing your body weight too much, not having too much of abdominal and pre-pubic fat, diabetes being under good control, maintaining erections, capable of being able to ejaculate both during sexual activity and during masturbation are the bottom line for this question. He anyway will get a semen out. He will use a partner. He will use himself. He will be masturbating and getting a semen out. He may take some medicines from our side, get erections around. But at the end of it, there are so many morbidities that he has. On one side, he's a diabetic. Other side, he's obese. Third is he is at this point in time in infertility, already married and therefore is not having children and therefore needs to get a semen report. That kind of morbidity should not touch our men in the International Men's Health Day, which we are celebrating to get people stronger and better. So if anybody is having these kind of trouble, they should see the urologist, andrologist, and these kind of patients. I continue to see morning till evening, almost every week. People come in from Monday to Saturday and see us for their various urinary and sexual issues, which happen to that class of men who are young, unfortunately, primary infertile, obese, sexual dysfunction, and the diabetes uncontrolled, which has already worsened the the entire dysfunction scenario.
Okay, thank you, sir, for your valuable advice. So the next question is: most of the men's health issues need long-term treatment or any maintenance therapy.
Yeah.
So we need a valuable advice to give to the patients to adhere to the treatment.
True. So remember,
Yeah.
it is not about having fever that you take a medicine and get well. It's
Yes.
not true. You
Right.
are actually going through an issue where there was something happening, you missed it out, you attempted some therapies, and now you're seeing a specialist called a urologist, andrologist, who's deeply interested in sorting you out, getting you back from the edge to a location which is much more safer. While we're
Yeah.
attempting that, we need to look at there are therapies which are instantaneous, there are therapies which are injectable, there are therapies which are medical, and there are behavioral therapies. While there's a lot of counseling happens in sexual dysfunction, a lot of behavioral therapies are brought about, a lot of partner activities and partner participations are brought about. We need to probably polish and get better and better. And one of the attempts that we normally do is to look at medical management. So there are a lot of medical management for hormone issues, a lot of medical management for erectile issues, there are a lot of medical management for premature ejaculation. So these medical issues are all conglomerate, which actually help us to get our erectile function back into the main road to be capable enough. And you taking medications, feeling good, and then stopping the medication does not work. Your uroandrologist in your city looks at improving you and therefore inducing you on therapies of the requirements that you aim and request for. As those therapies happen around, there's also parallel therapy where we want to improve and get it sorted. That getting sorted is such an important aspect. We need to improve it to levels from where you get to a level of maintenance. Now, when there's a maintenance, we de-escalate the dosages and bring the dosage to lower levels around. So the kind of tricks I'm trying to tell you is we want to see you do well. Once you do well, you'll continue to do well. But maybe you may not be performing sexually every day, as a result of which we will look at how to stabilize you and look at using a medicine either SOS or using a smaller dose on more of a regular or a weekly basis. And therefore, your doctor decides the kind of therapy he wants to give you. So the pillars of these therapies are medicines, sometimes which may be on a longer requirement. And therefore, you don't stop your medications around so early that you possibly will go back to the level where you were in. In other words, my request to all those patients and all those individuals who would require various medical therapies for very, very reasons diabetes, hypertension, sexual dysfunction, overactive bladder, incontinence of urine, so many things that we treat. And if you have got issues where you have recovered completely, a doctor decides how to escalate or de escalate medicines, and finally you recover. So, kindly don't stop medicines on your own.
Thank you, Dr. Sanjay. And Dr. Sanjay, some of our audience wants the explanations in Hindi actually. We
Yeah,
got this thing.
I would be keen
So
to talk in Hindi. So, please ask
yeah, तो
questions.
वही अच्छा है सर. Sir, next question है: Is vasectomy a safe procedure and can it be reversed?
बिल्कुल, बहुत अच्छा क्वेश्चन.
हाँ,
सो
हाँ,
वैसेक्टोमी वो है जिसे मेल स्टेरलाइजेशन कहते हैं, जो एक इरिवर्सिबल सर्जरी होती है. मैं खुश हूं कि इंटरनेशनल मेंस डे में पुरुष तैयार हो रहे हैं वैसेक्टोमी
हाँ,
के बारे में बात करने के लिए. अदरवाइज सैडली इस देश में, दुनिया में औरतों को ही ओफरेक्टोमी कराना
हाँ,
पड़ता है, उन्हीं को स्टेरलाइजेशन या बर्थ कंट्रोल की सर्जरी करानी पड़ती है, जो
हम्म,
पुरुषों में बहुत ही आसान तरीका है. वैसेक्टोमी वो है जहां हम स्क्रोटम में एक इंसिजन, छोटी सी इंसिजन या नो इंसिजन, नो स्कैल्पेल टेक्निक के द्वारा ये वैसेक्टोमी करते हैं. और वैसेक्टोमी बहुत ही सेफ प्रोसीजर. वैसेक्टोमी उस जमाने से चली आ रही जहां हम एक मेल स्टेरलाइजेशन या एक इरिवर्सिबल टेक्निक कर रहे हैं. तो याद रखिएगा, दंपति को ये जानने की जरूरत होती है कि अगर हम वैसेक्टोमी कर रहे हैं तो हमारी
हम्म,
फैमिली कंप्लीट हो चुकी है. हमारी
हम्म,
फैमिली कंप्लीट होने के बाद हम वैसेक्टोमी कराते हैं, जिसमें दोनों वास को हम इंटरप्ट करते हैं, दोनों वास को हम ब्लॉक करते हैं, ताकि हम जब सेक्सुअली परफॉर्म करते हैं तो हमें बेरियर कॉन्ट्रासेप्टिव्स और कॉन्ट्रासेप्शन की जरूरत ना पड़े. हमारी फैमिली कंप्लीट हो चुकी है और हम सेक्सुअलिटी में अपने आप को केपेबल पाए. तो वैसेक्टोमी एक सेफ प्रोसीजर है. वैसेक्टोमी पुरुषों की रिवर्सिबल प्रोसीजर है. दोनों तरफ की वास या वो ट्यूब जो आपकी सेमेन, टेस्टिस और एपिडाइमिस की एरिया से सेमिनल वेसाइकल्स तक ले जाती है, उसे हम इंटरप्ट करते हैं. तो इस तरह से आपकी प्रोडक्शन घटती नहीं है, प्रोडक्शन होती रहती है, लेकिन आपकी वो जो पूरी चीज है वो फिर इजैकुलेशन के द्वारा नहीं आती है. ये आपके डॉक्टर आपको समझाते हैं कि ये बहुत ही सेफ प्रोसीजर है. बहुत बार ये डे केयर में या एक रात की स्टे में की जाती है. आजकल नो स्कैल्पल टेक्निक के द्वारा हम होल से इसे निकाल लेते हैं, उसको इंटरप्ट करते हैं और फिर उतनी इजैकुलेट देखते हैं, इसके बाद इसकी प्रोडक्शन ना होने पाए.
ओके सर. लिंग पर तक कोई सर्जरी सर को बता सकते हैं आप?
फिर से पूछिए.
Is there any surgery to increase the size of the penis? लिंग पर तक सर्जरी कोई?
ओके ओके. तो लिंग परिवर्तन की जो सर्जरी होती है, जिसे हम फैलोप्लास्टी करते हैं, फैलोप्लास्टी वो सर्जरी होती है जिसमें हम लिंग की परिवर्तन कर सकते हैं. ये किन लोगों के लिए की जाती है? पहला, जो बच्चे हैं जो ग्रो कर चुके, एडोलेसेंस और एडल्ट हो चुके, पर उनकी पेनिस को माइक्रो पेनिस कहते हैं, वो लेस देन 2.5 सेंटीमीटर्स की है या 2.5 या उस परसेंटाइल में है जिसमें हम सेक्सुअली केपेबल नहीं होंगे, हमारी ऑर्गन डेवलप नहीं हुई। अगर ऐसा होता है तो हमने कल रात को एक लिंग परिवर्तन किया उनमें जो 23-24 साल के हैं, जिनकी बचपन में कुछ पेनाइल सर्जरी हुई थी लेकिन पेनिस ग्रो नहीं कर पाई, उनके टेस्टिस नॉर्मल है पर उनके मेल ऑर्गन नहीं है। अब 23-24 साल के हैं, सेक्सुअली परफॉर्म करना चाहते हैं, एक दंपति जीवन में अपने पार्टनरशिप में जाना चाहते हैं, लेकिन लिंग की साइज नहीं बढ़ सकती बिकॉज वो लिंग बिल्कुल छोटी सी है। तो ऐसे कंडीशंस में हम वो सर्जरी करते हैं जिसे फैलोप्लास्टी कहते हैं। फैलोप्लास्टी नॉर्मली मैं जेंडर रीअसाइनमेंट में करता हूं जिसमें हम फीमेल टू मेल सर्जरीज करते हैं, लेकिन पुरुषों में हम फैलोप्लास्टी कब करते हैं? तो पुरुषों में जिनकी लिंग बहुत छोटी है, जिनकी लिंग बड़ी नहीं हो रही है, जिनकी लिंग उनके सेक्सुअल कैपेबिलिटी में, दंपति जीवन में उनको हेल्प नहीं कर रही है, वैसे कंडीशन में हम आज के जमाने में उस तरह की सर्जरीज करते हैं जहां हम पेनाइल ऑर्गन को ही बड़ा कर सकते हैं। ये बहुत ही स्पेशलाइज सर्जरी होती है, इसको लाइटली न लिया करें, और ये सर्जरी आप डिसाइड नहीं करते। अगर आपकी इच्छा भी होती है तो आपके यूरोलॉजिस्ट डिसाइड करते हैं। ये सर्जरी बहुत हद तक भारत में हर कोई नहीं करता बिकॉज ये बहुत ही स्पेशलाइज तरह का काम होता है। तो यहाँ पे हम उस तरह की सर्जरी करते हैं जिसमें हम उसी ऑर्गन को बड़ा करते हैं या फिर हम नई ऑर्गन बनाते हैं। तो फैलोप्लास्टी मतलब प्लास्टिक रिपेयर विच इंक्लूड्स इंप्रूवमेंट ऑन द साइज ऑफ द पेनिस और क्रिएटिंग ए न्यू पेनिस। ये एक तरह की रिकंस्ट्रक्टिव कॉम्प्लेक्स प्रोसीजर है जो हम बहुत बार करते हैं और लोग इंप्रूव होते हैं। तो ये एक अलग तरह का ऑर्गन है जो हम बना रहे हैं या इसको इंप्रूव कर रहे हैं, तो इसकी रिक्वायरमेंट और इसकी थेरेपी बहुत ही अलग लेवल की इशू होती है, और ये की जा सकती है, ये की जाती है। जब हम इसके बारे में सब पैरामीटर्स में सेटिस्फाई होते हैं तो आगे बढ़ के इसे ऑपरेट करते हैं, जैसे हमने कल रात को किसी को किया।
Thank you, sir. Thank you very much for explanation. Sir, there are few more questions from the audience and we are running out of time. Should we continue?
Please go ahead.
Okay, thank you. So, one of our friend has asked, is phimosis normal at age 25?
So phimosis और टाइट स्किन जो प्लायबल नहीं है could not be normal, that's not the word, but could be present at that age, क्योंकि हमने अनदेखा कर दिया। पेरेंट्स सोचे कि ये स्किन अभी पेनिस छोटा है, बच्चा छोटा है, और शायद ये स्किन जैसे पेनिस ग्रो करेगा स्किन भी ग्रो करके लूज हो जाएगा। लेकिन जब हमारी नींद खुली और हम 25 साल के हैं और उस समय हमें पता चलता है कि ये स्किन बहुत टाइट है जिसे हम फाइमोसिस कह रहे हैं, तो ये नॉर्मल कहाँ है? अगर ये बहुत टाइट स्किन है तो ना आप यूरिनरी फंक्शन मेंटेन कर सकते हैं, ना ही आप हाइजीन मेंटेन कर सकते हैं, ना ही आप सेक्सुअलिटी मेंटेन कर सकते हैं। तो ऐसे कंडीशन में फाइमोसिस की ट्रीटमेंट सर्कमसिजन होती है।
Thank you. Thank you for explaining. The next question is, doctor, can thick semen production is good for health and how I can identify?
Come again.
Uh, thick semen, doctor, can thick semen production is good for the health and how I can identify? ये
Dr.
question.
Sovik, I already explained this, that thick
Yeah.
semen or thin semen has got little meaning. It has got no meaning. So thick or thin semen is because there is an agent which liquefies. हमारी semen thick रह सकती है और thin रह सकती है। ये thin और thick का जो पूरा दरिया है, ये एक्चुअली एक प्रोस्टेट से एक एक तरह की प्रोटीन प्रोड्यूस होती है जिसे सेमेनोगेलिन कहते हैं। वो इस सेमेन को नॉर्मली लिक्विफाई करती है। याद रखिएगा, नॉर्मली भी इजैकुलेशन के 20 मिनट्स में सेमेन की लिक्विफैक्शन हो जानी चाहिए। तो एक लिक्विड सेमेन, एक वाटरी सेमेन अपने में गड़बड़ सेमेन नहीं। सेमेन एक तरह का व्हीकल है, एक तरह की एक्टिविटी है जिसमें स्पर्मेटोजोआ स्विम करके जाते हैं और इस तरह से एक व्हीकल जिसको ट्रांसमिट करती है। तो थिक सेमेन और थिन सेमेन कहीं भी हेल्थ की कोई पैरामीटर नहीं होती, ये बहुत इंपॉर्टेंट है। आपको आइडेंटिफाई करने की कोई जरूरत नहीं है। अगर वो थिन सेमेन है तो सेमेनोगेलिन ज्यादा प्रोड्यूस हो रही है, थिक सेमेन है सेमेनोगेलिन कम प्रोड्यूस हो रही है। थिक या थिन सेमेन जैसे इजैकुलेट होता है उसके बाद अगर थिक रह गया तो बेकार है, फिर वो एक्टिविटी के नालायक नहीं रहता, फिर वो एक पार्टनर को फिर वो कंसीव करने में मदद नहीं करता, तो उसे लिक्विफाई होना पड़ता है। तो लिक्विफैक्शन के एजेंट्स होते हैं। तो थिक और थिन सेमेन के द्वारा न जाएं, वो आपकी कंफ्यूजन और मेंटल स्टेट को तंग करती है, वो आपका पैरामीटर नहीं।
Thank you. Thank you, Dr. Sanjay. So we have successfully completed the discussion for today. So almost all the questions are answered. And
I saw one question regarding
yeah,
early morning performance is good
yeah,
compared to
early
late
morning
night.
performance is good compared
So
to
you know
late
why,
night.
Dr. Sovik, early morning male performance is better than the late night performance? At late night, when you come back, you have a partner waiting, but you are personally physically tired. You're also
Yes.
mentally tired after long days of work. Number two,
Yeah.
that does not mean that you can't perform. But compared to early morning when you're fresh from sleep and you're fresh overall, your hormones also are at the highest level. So when your hormones are at the highest level, you actually are capable of managing yourself best. So to me,
Yeah.
it is such an important aspect that we need to look into and help these patients out. for making them understand that this is such an important aspect.
Okay.
So to me, it is extremely important for people to understand that the entire sexuality about satisfaction of oneself and the partner, a lot depends on the capabilities. Therefore,
Yeah.
it is a partnership issue. Sexuality of an individual is a lot related to the kind of capability he individually has, and then he partners his capability with the partner. So when we look at penetration, capability, ejaculation, masturbation, all those things around, we look at the mind and the body. We look at the mental state of these patients around. Today we're looking at health link and sexual links, and we understand that maintaining a great health is such an important issue. Your aspects of health, which is about diabetes, about blood pressure, about lifestyle, about the number of hours of sleep, to have regeneration of your body and to get your body polished to return back early in the morning. You sleep that number of hours, your rhythm of the body is maintained, your hormones are maintained very well, your
Right.
testosterone is maintained. If that's maintained, your possibly your andropause, who knows, may get delayed. I'm talking
Yeah.
only theoretical in that situation. It cannot happen so that you sleep well and drink well and your hormones will get better and better with passing time. It doesn't happen, but yes, you regenerate well. And therefore, male hormone is something which can only worsen with stress, which can worsen with various kinds of traumas which happen around. So, to be alive, to be active, to be hygienic, to be able to be in an aura of a good relationship is all that matters in sexuality, and that is always linked to your health, both mental and physical. They define in WHO that health is the absence of any infirmity and any disease. So,
Yes.
to decrease
Yes.
your mental and physical dysfunction is why you need to have a great partnership. And in International Men's Health Day, that is the motto that we all have.
Yeah, thank you, sir. Thank you. Since 3 days, we are discussing about the sexual health of the man. So I think we have covered almost all the aspects of the sexual health in this very short time. So what is your opinion, Dr. Sanjay? Anything
I
you
think
want
I
to
think
add?
the kind of audience questions I saw today and the last
Uh,
3 days overall, I'm
uh,
enthused that the kind of platforms we create for our society, where a lot of these things are not discussed. It's important for us to take audience questions. I also
mm,
enthuse our audience who happen to be on the edge with problems in sexuality, like the ones with the youngsters having erectile issues and the kind
mm,
of myths they live in. Other
mm,
side, they had a premature ejaculation, which we discussed today, and now
mm,
the transmission issues and partners' capability and the male hormones and the kind of issues we're looking at. I will not look at just being sitting there and only listening to the program and missing it out. At this important platform created from the ramparts of the Kokila and Dhirubhai Ambani Hospital in partnership with Lupin India to be able to reach all men on the International Men's Health Day, which we have decided to make it look as if it is a complete week that we are celebrating to make you aware. Don't keep sitting on awareness issues. Get into that awareness where we are looking at, and kindly don't ignore your health issues. You look at your overall health, look at your diabetes, look at your blood pressure, look at your capability, look at your mental health, look at your partnership, live in a good congenial relationship. That is what men's health is all about. We need to improve to such levels from where we only get better and better. So the questions have been good. I would only enthuse more and more people who have got trouble beyond this to go and see their doctors at Kokilaben Hospital. That I see a lot of people coming from the various cities and including Mumbai.
ah,
We treat them and probably get them better. I hope that these kind of programs help our people sitting on the edge and couples to make decisions to get treated and do better and better.
okay. Thank you very much. Thank you, Dr. Sanjay. And we are concluding the session. It's a wonderful session actually since 3 days and today also. And on behalf of Lupin family, we especially thank you for making this discussion rich and making this day a success. And tomorrow, we are coming up with one more discussion on men's health. That is, one more discussion on men's health. Do not ignore urological issues. So I request everyone to kindly tune in at the same time to have a fruitful discussion.
So
Sir,
till
you
we
want?
meet you tomorrow at 8:30, we're
Yeah.
looking at men's health and don't ignore urological issues. I think it's a great compendium. I look forward to wonderful questions from the audience. Dr. Shavik, you could compile many of them which come through the across to you.
Definitely,
And
sir.
live audience which always ask questions. I salute
Mm.
each of you in this audience for being a part of this wonderful campaign that we're bringing to you to probably break this menace of silence that you have. You are the
Right.
only one who can be a game changer. So as an
Mm.
audience, as an individual who's going through a trauma of sexual health and sexuality, continue to improve your men's health can do best only if you probably partner each other. And that's why the platform has been created. Thank you, Lupin
Thank you.
India. Thank you, Dr. Shovik. Thank you very
Thank
much.
you, sir. Thank you. Good night.
Good night.